Welcome to On the Spot. This is the February 2011 edition, and we got some nice feedback from the different look we had in January at the new hospital site. This month we're going to feature the 5-star team from the emergency department and some of the exciting work they're doing to improve patient satisfaction. But we really need to go inside to see that, so come on with me and let's go inside and look around. This has been a project that has really engaged every staff member, the physicians. It's been a true team effort in the emergency department. Really embracing and taking on things that they could do to improve patient satisfaction. And the results are remarkable. Over several months, continuously improving scores in their patient satisfaction, which really is impressive. Here in the lobby, you can see some things. We have a new triage area over here. We've reoriented the department so that the reception is much more patient-friendly and much more inviting. And we have new furniture and upgraded flat panel televisions. Waiting's never a pleasant thing in the hospital, but this makes it better for our patients. But the real innovation's really around the Rapid Care program. And here to explain that for us is Regina. So Regina, would you talk to us?
Good morning. We're really excited here in the emergency room about our newly remodeled area as well as our Rapid Care program. We are really focusing in on our patients and our families. So now when patients and families enter the emergency room, they'll be greeted by our RN who specializes in triage. Our triage nurse will designate whether a patient needs to be taken back in the emergency room, taken care of immediately, or our less acute patients will be able to be seen in our new Rapid Care program. So once they're identified, our new Rapid Care program, the patients will be directed to this direction. Come with me. Into our brand new Rapid Care treatment room. And in this treatment room, they'll be assessed and taken care of by a mid-level practitioner, either a nurse practitioner or a physician assistant. Once the patients enter this room, they're going to be seen, treated, and diagnosed and discharged right from this area. We even have a separate waiting room inside the emergency room, which is called our internal waiting room, where those patients can be discharged from as well. So what's going to happen with this is our less acuity patients will not have the wait time in the emergency room anymore. They'll be able to be seen, taken care of, and be able to discharge to go home. This is going to improve our patient satisfaction scores because it'll decrease the wait time. This will decrease the amount of patients that leave without being seen and will be taken care of immediately. Each of the nurse practitioners and the nurses will be working together to provide very good care for our patients.
Well, the emergency department's done a great job, you can see from that, and we're really proud of the effort that they made. And also a reminder that it was the President's Award grant that helped us fund those improvements. We won that grant last year for being the most improved hospital in Sutter Health. Now I'd like to shift gears and kind of talk a little bit about follow-up from last month. I invited all of you to submit your dreams or aspirations or what it meant to you thinking about our new hospital. And I want to invite you to continue to submit that information. Personally, one of my dreams, I have several, but one of them for the new hospital has to do with affordability. And that dream is that when we move into that hospital, we have our operations so efficient and so on target that we can make the money we need to make off of Medicare level payments. What that means is that we really need to continue to work on extending the tremendous progress we've made so far in that arena. And we're talking about things like rigorous case management, taking out the inefficiencies in the system and really focusing on the productivity and the labor cost of providing care. All of these things coming together. We're less than 10% away from reaching that break-even threshold, and that's going to continue to be a focus for us. And one of my dreams is that we're in that new hospital and we can pay the mortgage even if healthcare reform gives us a payment rate that's equivalent of Medicare. Now, as we're ready to put the wrap on this edition of On the Spot, I want to remind you first, submit your questions. We had 3 or 4 this time. They'll be printed in the Grapevine. Also, please submit your dreams and aspirations for the new hospital. I want to hear from you. And then thirdly, I want to tell you about a great celebration coming up to recognize the 5-star team and 5-star quality of the staff at Sutter Medical Center. We're planning an event in a couple weeks, February 24, from 4 to 5 p.m. in the Vesalius Room to celebrate the 5-star team. please don't miss this event because we're doing it for you to recognize you. Another thing that you're going to see soon is the unveiling of the Hall of Stars. We've been around here taking some photos recently of departments and staff and so forth, and I think you're going to be impressed when you see what we do with those in terms of really profiling the great people that make up the 5-star team and deliver the 5-star care at our hospital. Okay, so again, we're going to be looking for your questions and your dreams and aspirations, and please hit the link below and give us a piece of your mind.